Diabetes, types and warning signs. Do you ever feel incredibly thirsty even after you've had a drink? Or maybe you use the restroom more often than usual. These could be signs of diabetes, but don't panic. Today's show will shed light on this condition. We'll explore the different types of diabetes, their symptoms, and how to manage them. Join us as we unravel the facts and empower you to take charge of your health. There are two main classifications of diabetes. 1. Diabetes mellitus is type 1 or type 2 diabetes. Type 1 diabetes. This type of diabetes is caused by an autoimmune reaction that attacks the insulin-producing beta cells in the pancreas. As a result, the body produces little or no insulin. Insulin is a hormone that helps regulate blood sugar levels. Without enough insulin, blood sugar levels can rise too high, leading to the symptoms of diabetes. People with type 1 diabetes need to take insulin injections or use an insulin pump to control their blood sugar levels. Type 2 diabetes. This is the most common type of diabetes, accounting for about 90% of all cases. Type 2 diabetes is caused by a combination of insulin resistance and insulin deficiency. In insulin resistance, the body's cells become resistant to the effects of insulin. This means that the body needs more insulin to keep blood sugar levels in the normal range. In insulin deficiency, the body does not produce enough insulin to overcome insulin resistance. People with type 2 diabetes may be able to control their blood sugar levels with diet, exercise, and oral medications. However, many people with type 2 diabetes eventually need insulin injections. Gestational diabetes. This type of diabetes develops during pregnancy. It usually goes away after the baby is born, but women who have had gestational diabetes are at an increased risk of developing type 2 diabetes later in life. Monogenic diabetes. This is a rare type of diabetes that is caused by a single gene mutation. There are many different types of monogenic diabetes, each with its own cause and symptoms. Pancreatitis. This is an inflammation of the pancreas that can damage the insulin-producing beta cells. Pancreatitis can sometimes lead to diabetes. Cystic fibrosis. This is a genetic disorder that can damage the pancreas and lead to diabetes. Endocrine disorders. Some endocrine disorders, such as Cushing's syndrome and acromegaly, can cause diabetes. Drug-induced diabetes. Certain medications can cause diabetes. Diabetes insipidus focuses on water balance. This condition disrupts the hormone regulation of water reabsorption in the kidneys. It's not related to blood sugar. Blood sugar. Diabetes mellitus affects blood sugar, while diabetes insipidus does not. Cause. Diabetes mellitus is related to insulin, while diabetes insipidus is related to vasopressin, a hormone regulating water balance. Urine. Diabetes mellitus may cause frequent urination, but the urine can be concentrated. Diabetes insipidus produces large amounts of dilute urine. Treatment. Treatments differ significantly. Diabetes mellitus focuses on managing blood sugar through diet, exercise, medications, and potentially insulin. Diabetes insipidus treatment depends on the type, but often involves medications to replace or enhance vasopressin's effects. Diabetes symptoms can vary depending on the type of diabetes, but some general signs include increased thirst, polydipsia. When your blood sugar is high, your body tries to get rid of the excess sugar through urination. This can lead to dehydration, which makes you feel thirsty. Frequent urination, polyuria. As your body tries to get rid of excess sugar through urination, you may find yourself needing to urinate more often than usual, especially at night. Increased hunger, polyphagia. When your cells aren't getting enough glucose, sugar, from the bloodstream for energy, your body may send signals that you're hungry, even though you've just eaten. Unexplained weight loss. Even though you're eating more, you may lose weight because your body is unable to use glucose for energy and is instead breaking down muscle and fat for fuel. Fatigue. When your cells aren't getting enough glucose for energy, you may feel tired all the time. Blurred vision. High blood sugar can affect the lenses in your eyes, making it difficult to focus and see clearly. Slow healing sores. High blood sugar can impair circulation and slow down the healing process. Frequent infections. High blood sugar can weaken your immune system, making you more susceptible to infections. Skin problems. Diabetic skin problems can include dry, itchy skin, especially around the genitals, sores that are slow to heal, and fungal infections such as yeast infections. It's important to note that these symptoms can also be caused by other conditions. If you're experiencing any of these symptoms, it's important to see your doctor to get a diagnosis. Early diagnosis and treatment of diabetes can help prevent serious complications.